Hello and welcome to the School Health Services SHS Mid-Year Training. My name is Olga Ginshin and I work for the Colorado Department of Healthcare Policy and Financing. Throughout this presentation, you may hear us referred to as the department or HCPF. HCPF is the Colorado state agency that administers Health First Colorado, Colorado's Medicaid program. Here are the HCPF program updates for the 2024 mid-year training. We have a list of acronyms. If you aren't sure of an acronym that's used, please refer to this list. Here's our agenda for today, and I will go ahead and dive right into things. New CMS guidance. The new CMS Comprehensive Guide to Medicaid Services and Administrative Claiming was issued back in May of 2023. It's important to remember that participants will be notified prior to any program changes. All the changes that are upcoming for the program will be incorporated into future trainings as well as the program manual. But right now, the program is operating business as usual according to the current program manual. If you have any questions regarding the comprehensive guide, please make sure and direct those questions to HCPF. You can direct those questions to myself, Olga Ginshin. We want to make sure that the correct information is getting out to all of our participating school districts and BOCES, and want to make sure that everyone has the correct information. At this time, there are no anticipated changes around direct service billing. We do have a legislative requirement and proof of documentation is still required, so there will be no changes around direct service billing based on this guide. Remember that this new comprehensive claiming guide went out to the entire country. States that participated in the school-based services programs are in various stages of implementation of these enhancements that CMS lists. Colorado has already implemented several of these enhancements, including 1/12 interim payments. Colorado already has those. We expanded to free care on October 1, 2020. That means that we've expanded beyond just those IEPs. We now provide reimbursement for other plans of care, such as healthcare plans, behavior plans, 504s, that kind of thing. And we've also expanded our provider qualifications in Colorado. So you can put school psychologists and SLPAs on your staff pool list among other providers. There are two areas of the guide that we are going to have to change in the state of Colorado, and we're currently analyzing the impact. One of those areas is that bus aides will no longer be the sole qualifier for specialized transportation. A vehicle has to be modified in some way. You would have already heard from PCG. They are surveying all of the districts that claim for transportation, and they are doing that in order to quantify the potential impact to transportation claiming in the state of Colorado. So appreciate all of the efforts that PCG is putting into that analysis, and also appreciate the districts and BOCES that are replying to that analysis so we know how that's going to impact the Colorado state program. We're also analyzing the impact of a longer time study, so starting at the beginning of the school year, and also having fewer moments as part of the random moment time study. We reached out to our stakeholders back in our January stakeholder meeting, and we really did get some valuable feedback that we'll be taking into consideration as we move forward with these changes. Again, these are changes that are happening to the program in the state of Colorado. We are just trying to quantify exactly how much these changes are going to impact our program in Colorado. Here's the timeline. We've gone over this before, but the CMS Comprehensive Guide was issued back in May of 2023. In this current fiscal year, 2023-24, we are analyzing those two areas of the program, and we're in the process of developing an implementation plan. Then in fiscal year 2024-25, we will start working with CMS to approve changes to the PCAP. The PCAP is the document that guides the administrative claiming side of the program, and then also our state plan amendment, the SPA, that guides the direct service claiming part of the program. Then in fiscal year 2025-26, July 1st, 2025 will be the effective date for those CMS changes, and the deadline for mandatory changes is June 1st of 2026. Just as a reminder, the program in Colorado will operate according to current rules and regulations in the program manual until changes have been approved by CMS. And as a reminder, we will be incorporating any changes to the program in our upcoming training as well as the program manual. So keep an eye out for those items. National Provider Identifier NPI requirement check-in. Everyone knows now that we have completed the first phase of the NPI OPR requirement, which is having that NPI in the ordering provider field for PT, OT, and SLP services. Now we're moving on to phase 2, which is that individual providers need to have an NPI and be registered as a Medicaid provider. That needs to happen by June 30th, 2024. Some tips as you're working towards this requirement: make sure that you are starting with Gainwell to troubleshoot specific issues. And then please keep track of your application tracking numbers so that if any of those provider enrollments need to be escalated, you can provide me with that ATN in case I need to escalate any unresolved issues. I'm also happy to answer any general questions about the NPI OPR requirement. There are step-by-step directions and FAQs in the NPI OPR guide. You can always ask me any questions, but sometimes they're already included in those FAQs, and you might get a faster response if you look in that FAQ guide. Monitor claims and interchange to ensure program compliance, and use that NPI as soon as you can after these steps are completed to identify issues early. The reason that's recommended is that currently any invalid NPIs are being flagged, but they're still being paid. Eventually, those claims will be denied, and you want to make sure that you're using that NPI in the ordering provider field quickly so that we can identify any issues with those NPIs before they're being denied. School Health Services program stakeholders. We have a group of program support from across the state that act as mentors. They help us with information dissemination, with idea exchange. For example, I was just talking about the changes that are coming up for the random moment time study and how we received stakeholder feedback for those upcoming changes. They have a good amount of program knowledge. We do have a stakeholder areas of knowledge grid. If there is an area of the program that you have questions about, you can reach out to stakeholders using that stakeholder areas of knowledge grid. Their email addresses are on the website, and they also help us with training participation. They attend monthly mentorship meetings, and they also help us with our new coordinator training that happens during mid-year training. Here are your stakeholders. They're organized by CDE region, and we also have 3 community partners who are our current billing agents in the state of Colorado. National Alliance for Medicaid and Education, the NAME conference, was held back in October 2023 in Dallas. It was the highest attended NAME conference We discussed many issues, including the CMS Comprehensive Claiming Guide that was just issued back in May. There were general sessions by the Centers for Medicare and Medicaid Services, CMS, Office of Inspector General, OIG, and the Office of Special Education and Rehabilitative Services, OSERS. Those are always very highly attended general sessions. We always have a really good delegation from Colorado. We presented in 3 breakout sessions and have 4 members of named leadership. I am your membership committee chairperson. Marie LeBlanc is your program committee chairperson. Marley Hart is your named board secretary. And Shannon Huska is your Region 3 State Medicaid Agency representative. We had 32 attendees from the state of Colorado, so always a nice showing from our state. And an exciting announcement is that we will be hosting next year in Colorado. So there is an opportunity for even more Colorado delegation to attend. And we would encourage that if you haven't had it in your budget before for some of your program support to attend, we would encourage you to attend, and you can see how the program looks in other states. And also it is a great opportunity to network with other Colorado attendees. Program resources, we have office hours once a month. Those include Omar and I. Some attendees decide to just come and listen to other questions from other attendees, and some come with questions of your own. You're welcome to do either one. We have newsletters that are issued quarterly. We will include FAQs from this current mid-year training in the March 2024 newsletter, so keep an eye out for that and make sure that you're signed up for those newsletters. Interchange billing system, like I was talking about before, not only to look at those PT, OT, and SLP services to make sure that you're meeting that NPI OPR requirement, but also to make sure that your staff pool list in the PCG claiming system is well represented in that interchange billing system. School Health Services Program website and manual. We have a very robust website and manual. We have been quoted in CMS webinars, and also our time study implementation guide is listed on the CMS website as an example. So we do have a lot of really good resources out there, including past training recordings and many other resources out there. Also, your contract with HCPF. If you want to know what you are contractually obligated to do with the School Health Services Program, that contract is your best resource. If you don't have a copy of your current contract, please let me know and I'm happy to get you a copy. Public health emergency continuous coverage unwinding. As you all probably know, the eligibility redeterminations have resumed during the public health emergency. Because of COVID-19 pandemic, the redeterminations have stopped. Now they have resumed. The reason this is important is because schools are uniquely positioned to make sure that your families still have care. They may not be eligible for Medicaid any longer, but there are resources in here to make sure that if they're no longer eligible for Medicaid, that they get some other type of coverage. And also, your Medicaid enrollment rate is one of the ratios that's applied to your reimbursement. So this impacts your reimbursement that goes back to your school district as well. Here are some toolkits that you should take a closer look at. I'm going to keep my review very high level, but I encourage you to go back and look at what's available to you and see what works for your school district or BOCES. The toolkits that are available right now are the Update Your Address campaign, Keep Colorado's Covered, Take Action on Your Renewal, and Medicaid Scam Warning. So please just take a few minutes and see what is available out there so that you can best support the families in your school district. Those materials are also available in additional languages beyond English. These are the 11 most common languages spoken by our members in Colorado. There are also other flyers that are available. I could see these going home in a Friday folder or maybe a virtual Friday folder. On the renewals page itself, it helps guide you through the process of renewal in both English and Spanish. There are step-by-step instructions. And the renewal packet has been redesigned as well. So hopefully it's more straightforward and less intimidating for members to fill out. This is just the steps to renewal escalation. You would first start with your local county, and if you need to escalate beyond that, there is a complaint form available on the Health First Colorado webpage, and the link is right there. And this is just the difference between extensions versus reconsiderations versus appeals. InsureKidsNow.gov has a lot more information that's helpful as you are reaching out to families in your school districts and BOCES. And really, how can you help keep Colorado covered? You can look at all of these materials that I've just given a very high level overview of, include the messaging and emails and newsletters on your website and social media, whatever works for communication with your school district or BOCES. There are also flyers you can post in public areas. Like I said, you can also try to include those flyers in Friday folders. And also familiarize yourself with those toolkits. Keep updated on the FAQs on the website that's listed here. They are regularly updated. And also sign up for the public health emergency newsletter. There is a lot of data in there and helpful information that you will receive the latest updates. And for any questions regarding the public health emergency unwind, please contact Allison Ledden. She is the best resource at HCPF to answer your questions. And thank you very much for your time today. My email address and my phone number is listed on this last slide. Please contact me anytime for questions related to school health services. And thank you for your time today.